I therefore wish to seize this opportunity to urge members of the Association of Health Journalists to capitalize on the opportunity by participating fully in this program.
Tuberculosis trends in the Gambia are believed to have drastically dropped since 2006, a situation largely credited to the expansion of the latest TB control strategy, DOTS, and the high political will.
It could be noted that up to the second quarter of 2005, there were only 11 TB diagnosis centers in this country. However, there are presently 34 TB diagnostic and treatment centers in the country. According to our recent routine TB data, the National TB Control Program through the Ministry of Health has achieved the global target of 70% TB case detection and 90% treatment success rate, exceeding the WHO target of 85%, which is very rare in many countries.
It is gratifying to inform the Gabriel that under the visionary leadership of His Excellency, the President, Chief Professor Dr. Alhaji Yaya A.J. Jammeh, the Gambia government began implementing the DOTS strategy. This is the directly observed treatment strategy. Well before it was recommended and adopted by the World Health Organization globally in 1991. This is the most effective control of tuberculosis in the world. The Ministry of Health and Social Welfare has attained nationwide coverage of DOTS. I mean 100%. So the DOTS coverage is available nationwide in the country.
It is the latest capacity building effort for health journalists as they once again arm themselves with the essential knowledge and skills in the collaborative effort of TB prevention and control in the Gambia. Samuel Ba, Grts.
One Bengali charm, a native of Alunghare, Upper River region, has taken delivery of the keys to the Gamsel Yarbaram house at a colorful ceremony held in Bruford. The presentation was graced by Gamsel staff as well as friends and relatives of the winner. Fatu Jasti reports Gamsel authorities say this latest development underlines the company's responsibility of plowing back part of its revenue to the society.
And draw on GRTS television, the national GSM operator has finally presented the Yarbaram house to its winner. Bengali Cham, a Gamsel customer who resides in Alunghari, Upper River region, happens to be the owner of the expensive house built and furnished by Gamsel. It is definitely a dream come true for a man who, in his words, never thought of becoming a winner. Bengali, who was the envy of all, was full of praises for Gamsel. Her face beaming with smiles, Fatu Sisoho, wife of the winner, says she did not at first believe it when her husband told her the exciting news. It is another significant milestone for the GSM operator. Bengal's story is a clear testimony to Gamsel's willingness to give back to its valuable customers.
Bengali's story is a story that has to be told. It's a story that has to be told. It enlightens almost every human being. It touches on all of us. Bengali had an opportunity to travel. You've all had this on TV. He had an opportunity to travel, but because of his sick mother, he decided to stay, take care of his sick mother, and you see the reward today, that's the house.
Has actually demonstrated Gamsel to be the national GSM operator in the Gambia here. Because of the corporate entity as national GSM operator, which is translated as Yarbaram, we are mandated to plow back some of our revenue into the society.
It was a colorful presentation well attended by family members, friends and staff of Gamsel.
Gamsel is truly your national GSM operator. We are here for the Gambia and the Gambians.
For GRTS News, I am Fatu Jasi.
African Maternal and Child Health Day has been commemorated by Gambia Nurses and Midwives Association. The day, observed globally on May 23rd, is set aside by the United Nations to draw international attention to high mortality and morbidity rates among African women and newborns. Fatu Jasi again.
It was a day set aside to reflect on the trend and state of maternal mortality and child morbidity in Africa. The celebration took the form of a march past from Buffer Zone into Fajikunda Health Center in stormy weather conditions, with midwives showing greater commitment to this important cause. Suleiman Jame, president of the association, said this day creates an avenue to raise awareness of midwifery and to highlight the importance of the work done by midwives the world over.
The right to health is a basic human right that every woman should enjoy. Yet, every day, almost 1,000 women died in pregnancy and childbirth. This is really unacceptable. Every year, 8 million women suffer serious pregnancy-related illnesses and disabilities, such as obstetric fistula, and 2 million babies don't survive their first 24 hours of life. This is really pathetic. One of the main causes for these tragedies is lack of access to maternity services, including the care of midwives or others that are with midwifery skills at childbirth.
Credit Jambe went on goes to nurses and midwives serving in all corners of the country, which contributes to the reduction of maternal mortality in the Gambia, based on protocols and guidelines developed to meet MDG 4 and 5 by 2015. A UNFPA representative dilated on the importance of the day, adding that there is still more work to be done. The UNFPA official urged that his office is ready to support government, NGOs, nurses, midwives, and the community to reduce the rate of maternal mortality and children morbidity.
We are trying to increase access to family planning. The chairman don't just mention it because studies and experience have shown that if women are given the choice to be able to space their birth, that can contribute significantly in the reduction of mortalities. Also, another key thing that UNFPA is working with the ministry is in the increase of emergency obstetric care, because we know that if women are pregnant and then there are complications, if they are able to reach facilities in time, then the much needed assistance can be given.
Despite this vital role in improving maternal and newborn health, recent analyses indicate that midwives and midwifery services are unequally distributed both between and within countries. Direct investment in midwifery education, regulation, and association will create the necessary conditions for the midwifery profession to achieve its full potential, thereby accelerating progress towards meeting MDGs 4 and 5.
Addressing celebrants, Lamin Sen, Regional Director, West Coast Region, spelled out the great disparity existing between Africa and the developed world in healthcare delivery system. Maternal deaths in Africa due to complications during births, Sen stressed, is higher in Africa compared to the developed world.
In Africa, we all know is a problem, and the main factors, it is registered that 50%, more than 50% of maternal deaths are related to two main factors, that is hemorrhage and hypertension, which is something that is very serious. And as we are moving now in the Gambia, we stand at 3.4%, as against the set standard of 5.5 per annum.
This year's commemoration, hosted by Fajikunda Health Center, saw participation of nurses from all corners of the country, local dignitaries, and mothers from the locality. For GRTS News, I am Fatou Jassi.
Over now to an announcement from Kanilai Family Farms, which says it will start selling high-quality meat on Friday, 24 September 2012 at the Kanilai Family Farm outlets at the current market price as follows. Meat and bone, $120 per kilo, steak, $140 per kilo. The public is hereby urged to hurry at Kanilai Family Farms, the best place to buy high-quality beef at reasonable prices. You can monitor GRTS Radio live on our website at www.grts.gm. That takes us to our first break. We'll be right back.
There are many property companies out there, so making a choice can sometimes